Nurses rallied today in front of San Francisco General Hospital to urge the city to increase staffing ratios in the emergency room. The nurses allege staffing shortages are hurting patient care. The rally comes as the nurses union, the Service Employees International Union Local 1021, negotiated with management for a new contract. Nick St. Charles filed this report.
Nurses wearing purple SEIU shirts filled the sidewalk in front of San Francisco General Hospital. They held signs that read, "Safe staffing equals public safety." Jason Negron Gonzalez is a registered nurse in the emergency department.
Full staffing for our department to kind of have all areas of care completely open would be about 22 to 23 nurses per shift. We're typically now seeing a scheduling of around 18 nurses per shift, and at times as low as 15 or even lower.
Hospital management refutes these claims. Rachel Kagan is a spokesperson for San Francisco General Hospital.
We are in good standing with all of our federal and state regulatory agencies and also with the hospital accrediting organizations that we report to. There have been no findings that staffing is a problem or that staffing raises a patient safety concern.
Many of the nurses at the rally say short staffing has brought the hospital out of compliance with state-mandated ratios. Under California state law, emergency rooms must have at least one nurse for every 4 patients.
The state requirement also says in cases of higher acuity, that ratio becomes lower.
Dan Mayer has been a registered nurse at the hospital for the last 28 years.
And many of our patients are one-to-one patients. They are critical trauma patients. But I'll go into a trauma room with my critical trauma patient, and because there's no one else to take care of the others, I may have 2 or 3 other patients out there that I can't get to in a timely manner. So that is a violation of staffing ratios on a daily basis.
Mayer says he has seen the impact of understaffing firsthand. He described an emergency room visit by an elderly patient with Alzheimer's.
If you get busy, they sometimes lie there as you get sucked off into something else. So it took a while to get her blood test, and she kept trying to climb out of her bed. She wasn't aggressive, but she was curious. She wanted to see what was on the other side of the bed. And I was able to get what we call a coach, which basically means a nursing assistant to sit with her and just gently remind her to not get out of bed. And it worked fine for the first few hours.
Mayer says his assistant left their post that day due to short staffing. He says he asked supervisors for another assistant, but was told,
"Nope, there's nobody. You'll have to restrain her." If I hadn't restrained her at that point, she would have climbed out of bed, possibly broken her hip.
He says the patient didn't speak a
word of English, no family around, dementia, tied to a bed, because there was no nursing assistant to help her.
Hospital spokesperson Rachel Kagan says the nurses should take these concerns to the bargaining table.
At the same time that the SEIU members were protesting outside of San Francisco General today, another group were at the bargaining table across town. And SEIU and the city are currently negotiating for a new contract, and many of these issues, wages, working conditions, staffing, are being discussed at the bargaining table, which is entirely appropriate and where they should be discussed.
The nurses want the hospital to increase emergency room staffing levels with union healthcare workers. Contract negotiations are currently underway. The union hopes to reach an agreement by May. Nick St. Charles, Pacifica Radio, KPFA, San Francisco.